Hello and welcome to a new episode of our Your Health podcast. My name is Jan Klusacek and our guest today is Theodora Calinescu, Project Manager at the European Transport Safety Council. Welcome.
Hi, thanks a lot for the invitation. Very happy to be here.
Could we start with a few words about yourself, about your background and about your organization?
Sure. Well, I would start with a few words about my organization, the European Transport Safety Council, whose main objective is to have less people killed and seriously injured on the roads. We are a Brussels-based non-profit organization who for the past 30 years has been promoting effective road safety measures based on international research and good practice. What we do is we offer a source of impartial expert advice on road safety matters to the EU institutions, to member states. So a lot of our work is policy work, but we also run a few projects on different road safety topics. We also have a network of 50 member organizations throughout Europe, including the Czech Transport Research Center. We work with over 200 experts on different topics of road safety, and we are fully independent by having a variety of funding sources. Personally, I am a project manager with ETSC. I've been there for the past 6 years. For the last 3 years, I was coordinating a large EU-funded project on best practice exchange.
Great. And so what are the statistics in the recent years on road death? Well, I understand that probably those statistics were significantly influenced by COVID, by less transport, a lot of home office, etc. So people are probably less traveling. So that could help a bit with the death count. But are we successful in attempts to decrease death on the road?
Well, last year alone we had around 19,900 people killed on EU roads, and we had around 120,000 seriously injured. That's an average of 45 road deaths per million inhabitants, an average that obviously masks a lot of differences between the countries. So I wouldn't really call it a success story, with these figures in mind, but if we are to compare to the rest of the world, then sure, Europe's roads are the safest, and they have been improving over the past 20 years. You are very right, the last 2 years saw an extraordinary reduction in the number of road deaths. But unfortunately, it was not due to an effective set of measures, road safety measures, but it was rather the consequence of the traffic restrictions imposed by the pandemic. And sadly, the governments did not do enough to maintain this positive trend. So what we are seeing now is the numbers going rapidly back to the pre-pandemic levels. Mm-hmm.
Maybe it has something to do even with the economic situation, because as I believe, death on the road are closely connected to the age of cars on the road as well, because newer cars are generally safer, equipped with all those fancy features and AI stuff, etc. And when people are economically struggling, they cannot afford newer cars, and then they use their old cars, less safe, and which is generally less much more risky. Is it right?
It's true. Of course, it's a correct argument. But when we talk about road collision, there are always a multitude of factors that determine whether a road collision will take place or not. Vehicle is one of them, but of course we also talk about the road environment, the road infrastructure. We talk about driver behavior and all the risky behaviors associated, such as speeding, drink and drug driving, distraction, very, very popular nowadays, behind the wheel, not wearing restraints, and so on. In what regards vehicle safety, because you mentioned older cars being less safe, which is correct, we also see the opposite trend. So we actually see new cars being fitted with more and more safety technologies that do protect both the users inside the car and more the ones outside the car. Recently, the EU, back in July, in fact, the EU General Safety Regulation came into force, and this mandated a list of 19 safety technologies on all new cars in the EU, which we think it will make a big difference in the coming years.
There are huge differences between various EU countries when speaking about the road safety, and it's not obviously only related to the age of vehicles. We know that in Czech Republic we have one of the oldest car park in EU, but could you maybe in a bit more detail describe the other factors that cause why it's so different to drive with the hope of living through the road in various countries?
So what is behind the differences?
Yeah, maybe if you can just throw in some of the reasons, because there are some that are rather obvious, but on the other side there are some that. At least for me, as a just a general population, are counterintuitive. You know, for example, in Czech Republic we have zero tolerance to alcohol, and
bravo for that.
Sorry,
bravo for that.
Yeah. Yet still there are quite a few people who do not respect that. On the other side, in many other, let's say, Western European countries, there is some level of tolerance. In UK, even if it's not in EU anymore, it's 0.8, which is quite a lot of beer that could be drunk before driving, and actually driving on the wrong side of the road. So that's another point. But
yes.
Maybe we could.
Yes. Well, there were a few questions in there, but I'll try to touch on the different points. Right. So as you mentioned, and as we said before, the differences between countries are enormous. We have a factor of 4 between the best and the worst performance in the EU. We have on one end countries such as Sweden, Denmark, the Nordics in general doing very well, having around 20 road deaths per million inhabitants, while at the other end, countries such as Romania and Bulgaria have 92 and 81, respectively, road deaths per million inhabitants. There are many reasons that can explain these differences. I think although road collisions are generally caused by the same set of factors, the ones I mentioned before, infrastructure, vehicle, driver behavior, all the risky behaviors associated, I think the difference comes from how the countries are dealing with these issues and the measures they put in place to protect road users. We see different in the way the countries approach road collisions. We have countries with a long road safety tradition, such as Sweden, such as the Netherlands, who adopted early on the safe system approach. This is something that I meant to tell you, because while researching this podcast a bit, I watched a couple of episodes, and I saw that you were talking about harm reduction strategies. Yeah. Yes. And that's
a huge topic here, but I consider that as a part of harm reduction, because road deaths are pandemics of its own, right?
Exactly. So the similarities I was seeing between the system approach and the harm reduction strategies is that the safe system approach also accepts that humans will inevitably make mistakes. Yeah, and at some point they will make decisions that will lead to either a road collision or to injuries. But these human mistakes should not cost them their lives, or should not have severe consequences. So what the safe system approach does is builds a system that will protect the user despite the mistakes that he may do. Yeah, so we build safer roads, we build safer cars, we make speeds safer, so that in case a collision happens, it will not have the worst consequences. So I think this is where the difference in the statistics comes from as well. The way governments are approaching road collisions and the measures they put in place.
Maybe you could just provide us, you mentioned the best practice, so maybe you could provide us what are the most important recommendations from the best practice that should countries like Czech Republic, which is let's say on the higher level of road death, what we could adopt, what we could implement from the best countries in EU.
There are many good practice examples. Of course, it depends what area of road safety we're talking. Speed management, for example, good automated speed management system can be found in France. And actually, as part of the project that I was coordinating, the Best Practice Exchange Project, we took some national authorities there to the management center and see their operation. A good practice in its own is the safe system approach that I mentioned, and Sweden is renowned for this, and I think they have a lot of good things to export to the other countries. Also talking about enforcement, one good practice that we saw on the ground with the project was the latest advancement in road enforcement, meaning automated cameras that use artificial intelligence to detect handheld mobile use behind the wheel. Because as I said, this is one growing issue, the use of mobile behind the wheel.
Mm-hmm. That's very interesting. Okay, let me ask you on 3 specific questions that I'm always interested in relation to road safety. As someone who drives about 50,000 kilometers a year, so I have my own experience on that. Well, the question number 1 is German Autobahn unlimited speed. Do you think, or does your statistics somehow say that it's less safe or significantly less safe than let's say 130 as it is in Czech Republic?
Yes, indeed. The sections of motorways with no speed limits are relatively more dangerous than the ones with speed limits, and it has been a long-lasting recommendation of ETSC. Mm-hmm. To Germany, to the German government, to introduce speed limits on all motorway sections. Okay.
So maybe somehow it will be maybe more caused by the climate change issues, but
whatever argument works for reducing speeds, yes. This has been done in the Netherlands already, putting down speed limits on motorways for their climate impact and energy saving.
Mm-hmm. What about the current trend of everything on a touch screen, that you need to adjust temperature and heating of your seats and everything just on a touch screen? My own experience is that you spend much longer time watching at the touch screen than you can just blindly turn a knob and set it as you wish.
Yeah, indeed. I mentioned the mobile use behind the wheel, but it's true that this sort of touch screens are equally as distracting, if not more, because as you said, you spend more time not looking at the road. It's worrying, of course, and I think this is why it's also very important that drivers are trained for the new technologies as well that are being installed on cars. Not only entertainment-wise, yes, but also the safety technologies, all the other technologies should be very familiar to the user, so they don't spend time, get distracted by trying to set things up.
Mm-hmm. Maybe that should be part of driving school curriculum as well, to just know what works and how it works.
Indeed, and it's actually now in the works. So at the EU level, the driving license directive is being revised under the Czech presidency. So one of the issues that they are considering in the revised directive is updating the curricula for driver education to include training on these new technologies.
Okay. And the third thing is maybe a bit controversial, but it's in relation to all those new autopilot, self-driving, so-called self-driving cars, which are not technically, obviously, self-driving. They still require some level of attention, that you must watch the road and keep your hands on the steering wheel. But once you do not need that level of involvement in the driving, my own experience is that you tend to, let's say, a bit slip. When you need to do everything manually, you really concentrate on the driving. Once you the car drives pretty much itself on a straight motorway, you are a bit more, I would say, motivated to look at your phone or eat or do something that distracts you. So, don't you think that all those new technologies actually, to certain level, decrease the safety because they decrease the attention of the driver that he puts on the driving itself?
Yeah, yes. I mean, there's a lot of over reliance on systems, and this is indeed a topic of concern for us at ETSC. The semi-automated vehicles and the fact that indeed, as I said, people over-rely on their capacity to drive for them. Yeah? And cars are at the moment at a very dangerous level, this semi-automation, where you have the impression that the car is capable of doing much more than it actually can. It's dangerous, and we believe that we are really quite far yet from having fully automated vehicles on our roads. And before having them, we really need strong regulations. Mm-hmm. We really need to set the clear rules for their use, yeah, because otherwise, and it's already noticed that they are causing other issues, yes, the interactions between vehicles and the ones outside.
That's interesting. So let's move a bit to the institutional level and organizational level. What are, do various organizations like European Commission, World Health Organization, many other stakeholders, do they work together in preventing road death, or is it everybody playing on his own field and not really working in cooperation?
I'm not sure about the institutional cooperation. But if we talk about cross-sectoral cooperation, indeed is limited. It's much less than we would like to see, and much less than we think would be beneficial for road safety. There are, of course, examples where the road safety world joins the health professionals in order to improve road safety. Maybe I can give you an example of that. So, for example, we have the alcohol interlock programs in some countries that are, of course, dealing with drink driving, with prevention of drink driving. And these programs are always coupled with rehabilitation programs. So then we have health professionals, especially psychologists, working with road users to keep them from having risky behaviors on the road. We also have cooperation between the sectors when it comes to serious data collection. Again, in some countries, unfortunately, it's not the norm. But in some countries, because road serious injuries are often underreported, using only police data, we have then health professional hospital data coming to complement this image and giving a more clear image. But these are specific cooperation and not institutional ones. Yeah.
Mm-hmm. And we could step back on the topic of drug use and alcohol use in relation to driving. What could be actually done to decrease? You mentioned this program, but in general, what could countries adopt? What measures could adopt in trying to battle this dangerous habit? Because I believe that everybody who sits behind the steering wheel knows that it's dangerous. pretty much everybody older than, I don't know, 6 years knows that it's dangerous and it shouldn't be done. If you're drunk, do not drive. Yet still, people die every day.
Yes, you're right on that, and the science is also very clear on the exponential risk of driving after after being intoxicated, be it with alcohol, be it with drugs, or the combination of both, as it is the case in many instances. You mentioned earlier the BAC limits in some countries being higher. Well, we know, science has shown that a BAC, a blood alcohol concentration limit of between 0.5 and 0.8 grams per liter, increases the risk of being in a fatal collision 20 times. So then those policies are a bit hard to justify. And there are some driver categories that are particularly at risk. And we are talking about young male drivers who not only have a higher risk of collision when they're sober, but this risk increases even more after they consumed alcohol or drugs compared to their elderly, more experienced drivers. So that's why many countries have moved towards zero tolerance for young drivers. Yeah. When we talk about measures, again, we talk about a set of measures. I would mention first enforcement, including random roadside alcohol breath testing, which is really essential for drivers' perception of being caught and punished if they go behind the wheel after drinking. One of ETSC's recommendation is this intensifying enforcement by also setting annual targets for random checks and couple them with intensive publicity activities. So we want the people to know that the police is there, that they're on the road, and if you drive, you will be caught. So this would be one measure, enforcement. Then you would have zero tolerance policy that we mentioned, so setting a BAC limit of no more than 0.2 grams per liter for all road users. Czech Republic is one of the 9 countries that are already using those limits. Yeah. Then the measure of the alcohol interlock programs. Yeah. This has proven to be an effective and cost-beneficial measure. Which also has a lot of positive social impact, yeah, because the drivers who were caught drink and driving repeatedly or with a high value initially will get to keep their driving license and keep driving while they're sober. So the way it works for those who don't know, there's an ignition device, alcohol ignition device, that only allows the car engine to start after a breath test has been completed and show that you are sober. This coupled with rehabilitation programs really cuts reoffending rates. And it's a program already used in several countries, in Austria, in Belgium, in France, Finland, Sweden. So countries have already understood the benefits of such programs.
12 years ago, Volvo adopted his zero death strategy. They didn't really succeed, let's be frank about that, but they now postponed it to another 10 years. So how do you think will road safety look like in 2030? Will we achieve a significant decrease in death on the road?
Well, I think despite the result you mentioned, it's essential to adopt Vision Zero as our driving force. Yeah, even if maybe this target is not achievable in the next 10 years, it's important that we aim towards achieving zero fatalities. There is no other ethical goal to have. So all the measures need to work towards having zero road deaths and serious injuries. And of course, it's not easy, but I think it's manageable as long as we have the forces of infrastructure, vehicle speeds that will lead to crash energy levels that the human body can tolerate. Yeah? And of course, these measures need a lot of political will. They need strategic planning. They need cooperation between the various sectors, accountability, and of course, investments.
Mm-hmm. Do actually voters accept that vision? Do accept that they will need to change the way how they behave on the roads in order to not achieve, but at least get a bit closer to this vision?
Who is that?
Do voters?
Voters. You mean people?
General public.
General public. I don't think that you will ever meet a person who would willingly accept that maybe a member of his family gets killed in a road collision. Yeah.
But many people just feel like, well, it doesn't really concern me. That's a distant thing. Maybe I know someone vaguely who got hurt, but it cannot happen to me. I drive really safely and no problem with that. Right?
Yeah, but you know that in reality it affects all of us. Yeah. And
it affects whole countries economically. It has huge.
It has a huge economic impact as well, besides the human tragic loss. Yeah, and I think it's the voters, as you say, the general public would be even more on board with all the measures if the risks are a bit better explained. Yeah, and the politicians make a case of actually taking responsibility to propose stricter measures and then see the results in maybe 5 to 10 years. Yeah, we need this kind of leadership, because once people see the benefits of stronger measures, they see that we have less people killed, we have less people seriously injured, suffering from this, then of course they get on board. And also I think there is a major, a silent majority in favor of stronger road safety measures. It's usually a loud minority that says no speed cameras, no controls.
Okay, well, I love to end the podcast on something positive, and I guess it would be hard to find anything more positive than your last statement. So thank you so much for your time. It was great having you here.
Thank you very much. It was very nice being here.